Hello everyone, welcome to Uncle Yeow and the Singapore story. Now today we are going to discuss how Singapore managed to tackle the COVID-19 pandemic. Alright, I think we have fared very well in terms of all the different countries around the world. We have done quite well, and government has actually published a white paper on looking back on COVID-19, what we have done well and what could have been improved upon. So let's take a quick look and then discuss some of the findings. Now this is the government published paper on looking back on COVID-19, reviewing our experiences, a summary of it, of the findings. So we'll go through some of them. All right. Now, what have we done well? Well, number one, healthcare system. If we talk about healthcare system, we have to actually go back to 2003 when SARS broke out around the world, and Singapore was actually the third country that was affected after China and Hong Kong. And during SARS, all right, SARS is very deadly, much more deadlier than COVID-19. The death rate for SARS is more than 10%, whilst the death rate for COVID-19 is 2%, around 2%, all right? Now, because of SARS, after SARS, then we had to review and revamp our healthcare system. In fact, a lot of our public hospitals, all right, will ramp up, especially if you look at new hospitals like Ng Teng Fong, Sengkang, all right, Khoo Teck Puat, and a few others. So this is actually to ramp up our capacity, all right. Second is actually in terms of our national vaccination for COVID-19. I think Singapore is one of the earliest countries to actually place orders for vaccines, and we took the risk, but in the end it proved out to be correct, and we actually have ample vaccines to vaccinate large population, and this has actually managed to mitigate the spread of COVID-19 and the infection of COVID-19. Next, we managed to keep our economy open as far as possible, secure food and critical medical supplies. That's very important. And then number four, we supported livelihoods, provided loans to businesses, rebates, and facilitated job placements. In fact, during this period, countrymen all have a lot of help from the government in terms of all the various vouchers and subsidies, all right, to tide people over a very difficult period. And then there was also support for the vulnerable, all right, financial support for those in need. And then we kept our education system and resources going. Everybody were provided with laptops for their home-based learning, so that lessons could actually be continued, and therefore the students in large part do not lose out very much. And very important, number seven, we maintain a high public trust. Now this is very important because without the public trust, a lot of things could not be done. All right, and I think the ministerial task force press conference that gives timely, accurate information to the public, that helps a lot. And not only that, I think a lot of the information, government was quick to react, especially when certain things were not right, they quickly put it right. For example, in the early phases, information about mask wearing was not very good, but later on we quickly corrected that, and then mask wearing became compulsory. So these are some of the things that actually, and then if you look, last but not least, we rallied the nation. All right, community support, everybody helped. Now, it's also very important, especially to thank all our frontline healthcare workers and everybody who was involved, especially even the safe distancing ambassadors, all right, to manage all the public crowd control. And this has helped overall to rally the nation, all right, so that we could all get through with the pandemic. I must also say that the ministry or the government has got it right when they first term it as a circuit breaker and not as a lockdown as in most other countries. Because the term lockdown sounds like imprisonment, whereas a circuit breaker, everybody knows, is a temporary thing whereby we have to tide over and to make sure that everything could go back to square one, right? Now, what could have been done better? Well, these are some of the things, especially the outbreak in the migrant worker dormitories. Nobody expected that. And I think the migrant workers dormitories' living conditions were not up to scratch. And therefore, that caused a lot of infections. But this has since been put right. All right. And so now that is something that we should continue to monitor, especially for future pandemics. Border measures, well, I think borders lockdown, all right, could be better managed so that to prevent a lot of infections to slip through. And then, like I say, mask wearing policy, all right, initially it was not very clear whether mask is compulsory or not. And not only that, in the early phase, Singapore actually, we had 2 mask manufacturing lines in Taiwan, and eventually we pulled them back to Singapore to produce masks for our own population. So that helps, all right. And not only that, especially the Temasek Foundation have been issuing free masks, reusable masks for the mass population. So we did not have any shortage of masks as in most other countries. So there was sufficient masks. And of course, contact tracing. The adoption rate for the Trace Together app was low in the beginning because people do not know how to use it. But after a while, everybody got used to it. And I think this is something that we should try to promote going forward whenever there is some kind of a pandemic. And then, of course, safe management measures, all right, safe distancing. This is something we could have done better and managed better. And then transition to being endemic, repeated tightening and then easing of measures during the Delta waves. So a lot of people find that there's a lot of toing and froing, and therefore it is not very clear. And then shift to home recovery program happened too quickly and created anxiety. So these are some of the things that we could have done better going forward. Now, ladies and gentlemen, like I say, overall, Singapore has done very well. COVID-19 infections in Singapore numbered about 2.7 million, but the number of deaths as a result of COVID-19 was 1,900, which is actually the lowest death rate in the world. So overall, I think we have done a lot, and this is worth sharing with other countries in terms of how we manage to control COVID-19. And therefore, going forward, like I said, the most important thing is public trust. If the public do not trust the government to take the right actions and then to remedy if there's anything that is not working, to quickly rectify it, all right, being very pragmatic, then the trust will be eroded and then things will be very difficult to manage. So this is what public trust and the pragmatic approach of the government, especially the multi-task force, ministerial multi-task force, communicating openly with the public on a daily basis, These are things that we should enhance over time, and therefore be prepared for the next pandemic. All right, with that, this is Uncle Yeow saying thank you